My name is TJ Melton. I'm an orthopedic surgeon at Blue Ridge Orthopedics in Seneca, South Carolina. I'm originally from the upstate of South Carolina. I grew up in Travelers Rest, went to Furman University, and then attended the Medical University of South Carolina in Charleston on a military scholarship through the Army. So after medical school, I started my military service. My wife and I moved to the Pacific Northwest. I did residency at Joint Base Lewis McChord in Washington State. After I finished residency, we were assigned to Camp Humphreys, South Korea, where I was responsible for providing orthopedic surgical care to the soldiers, sailors, airmen, Marines, and their family members in the Korean Peninsula. Had a great experience in Korea. Family enjoyed it there, had a son born there. Fortunately, after Korea, we were able to come closer to home, back to the Southeast. We were stationed at Fort Campbell, Kentucky. I had a great time because I got to do a lot of hunting there, and then it was a good opportunity because it's the home of the 101st Airborne Division, elements of the Special Forces, so a great group of patients, highly motivated individuals to take care of. After I finished my military service, I knew I wanted to obtain additional subspecialty training as I transitioned to civilian practice, so we moved to Cincinnati, Ohio for a surgical sports medicine fellowship. I got further specialization in arthroscopic and open surgery, principally involving the knee, shoulder, and hip. Also took care of athletes, ranged from local high schools, college, and the professional ranks. We assisted with the care of Miami University as well as the Cincinnati Bengals. After Cincinnati, my family and I had the opportunity to go overseas once again. I completed an additional fellowship in shoulder and elbow surgery in Cambridge, England, at Addenbrooke's Hospital, part of the Cambridge University Hospital system. And that was an incredible, personal and professional experience. And after that, fortunately, I've had the opportunity to come back home to the upstate. As an orthopedic surgeon, I have a strong interest in sports medicine, so taking care of athletes, ranging from the high school athletes, the weekend warrior, just really focused on getting people back to their prior level activity following an injury or some degenerative condition, and whether that's seeing people in the clinic or obviously in the operating room. Two main reasons why I went in orthopedic surgery. One, we're molded and shaped by experiences when we're kids. I played a lot of sports growing up. I tore my ACL playing high school football, and I had ACL reconstruction surgery, so I probably piqued my interest early on. And then when I went to medical school, you're doing all your rotations and various subspecialties. I thought I might want to be a general surgeon as I did some shadowing and research with the general surgeons here at Greenville Memorial Hospital when I was at Furman. But kind of birds of a feather sort of thing. When I rotated with the orthopedic surgery department, I got along with those guys really well, and I just thought the work was a lot of fun. So obviously eventually ended up going into orthopedics. Yeah, in terms of patient education, I think it's important to remember that particularly in orthopedics, and part of that makes it fun is not every patient has the same answer or solution. You might prescribe a different treatment for a different patient, even with the same problem. So just meeting the patient where they are and explaining those options, and kind of through a shared decision making, determining what the most appropriate answer is for whatever brings them to the office. So I have a lovely wife, Shannon, and we have 3 kids. We've enjoyed our kind of adventures and travels around the world together. The next adventure is going to be hopefully settling some roots, establishing some roots in the upstate. Personally, I like being outdoors, like hunting, fishing, hiking. I love sports, like watching college sports, and enjoy reading kind of non-medical things when I can. To schedule an appointment with me, please ask your primary care provider to make a referral to me.